Kristen Landau is an energetic mom of two, chasing her young boys around a busy Iowa home. But last year, a stage 4 cancer diagnosis at just 39 years old threatened her family's future.
It was very, very scary. My boys are so little, I thought, they need a mom. What's gonna happen?
So she told her doctor she was ready to fight.
I basically told him, do everything that you have to do without killing me so that we can get rid of this, so I can be a mom to my kids. I didn't know if I was gonna make it to my 40th birthday, but I did.
She did, thanks to aggressive treatment and a chemo drug called carboplatin. Then, this spring, the drug that shrunk her tumor and was halting the spread of her disease was no longer available.
It's scary to be back in the what if phase. What if this doesn't work? What if they can't get my drug back? You want me to hold on to that?
Kristen is among as many as 500,000 Americans dealt the devastating double blow of a cancer diagnosis and unavailable life-saving drugs. According to the FDA, 15 drugs for cancer treatment were in short supply in August. Among them, drugs called cisplatin and carboplatin, sterile injectables that are some of the most commonly used and relied upon chemotherapy drugs.
Those drugs are the backbone of therapy for lung cancer, ovarian cancer, bladder cancer, testis cancer. And the next best treatment is just that. It's not as good.
Oncologist Dr. Kristen Rice showed Spotlight on America this email from June from the supplier that provides drugs for her patients. Look at the words next to these essential drugs: strictly allocated, limited supply, backordered, production problems. What was your immediate reaction when you saw that email?
Terror. It's incredibly stressful for us and our patients to deal with these shortages when they come up.
Have you had to have conversations with your patients about altering their treatment plan because of the shortage?
Absolutely. It's not a conversation I ever thought I should have to have.
According to the National Comprehensive Cancer Network, this summer, 93% of cancer centers surveyed reported a shortage of carboplatin. 70% were short on cisplatin. The cancer drugs in short supply are older, generic medications, ones that are cheap to buy, as low as a few dollars a dose. So companies aren't incentivized to make them, and few do. The ones that do manufacture them aren't here in the U.S. They're largely located overseas, in China or India.
That makes it even harder for the FDA to oversee the quality and to have any idea about the quantity that's being produced. So we've really lost all control of the process.
Do we have any national sense of the demand for these drugs?
No, which is just inconceivable. But the FDA really doesn't have a way to monitor the supply, and they certainly don't have the ability to foresee changes that may drive up demand for a drug.
That's what got us here, a factory in India that makes a significant portion of our carboplatin and cisplatin shut down production late last year after a 36-page report identified troubling violations, including a worker pouring acid in a bin of documents to destroy evidence of problematic results. Failures thousands of miles away continue to leave providers like Dr. Rice not only scrambling to create a plan for her patients, but trying to figure out solutions.
I did not get trained to manage drug supply chains and figure out the complicated economics of drug development in the United States, but here I am.
Every time that I go, I'm hoping that it's going to be the day that my drug that I should be on is in.
For now, Kristen Landau is using a different drug, one that makes her sicker. It seems to be working. Even if carboplatin returns, the once plentiful drug will be rationed.
The FDA says it's working hard on this issue. The president's task force has yet to get it sorted out. Members of Congress are arguing over the politics of profits with pharmaceutical companies. What's your message to all of them?
Figure it out. I would like them to think about how they would feel if it was their mom or their sister, someone that they cared about that needed this.
For Spotlight on America, I'm Lisa Fletcher.
Hi, I'm National Investigative Correspondent Angie Moreski. Thanks for watching Spotlight on America on YouTube. If you enjoy our investigative reports, please consider subscribing to our channel. And if you have a tip for a future investigation, we want to hear from you. Just send your idea to spotlight@sbgtv.com. And we'll see you next time.